This is our 2-minute warning. Thank you. Okay, good afternoon, everyone, and thank you for joining us. From the Legislative Building in Regina today, we have Health Minister Jim Reiter, SHA CEO Scott Livingstone, and on the line we have Dr. Shahab, Saskatchewan's Chief Medical Health Officer, as well as Dr. Susan Shah, SHA Chief Medical Officer, and Dr. Rashad Hansia, Physician Executive, Integrated Urban Health. We'll have an opening statement from Minister Reiter and Scott Livingstone, and then we'll take questions. Minister Reiter.
Thank you. Good afternoon, everyone. There are 2 new cases of COVID-19 reported today. There are 21 active cases and 1 person in hospital and ICU. With our case numbers remaining low for the past few weeks, we've been able to move forward with reopening businesses, services, and activities throughout the province. We're also able to restart many of the medical services that were temporarily paused, like the reopening of emergency rooms announced by Premier Moe earlier this week. I'm here today with Saskatchewan Health Authority Chief Executive Officer Scott Livingstone to provide some additional details on the next phase of health services resumption at the Saskatchewan Health Authority. I want to thank Scott and the thousands of healthcare providers for all their work on COVID-19 response and their efforts in recent weeks on service resumption. Today, SHA is announcing that it will enter its second phase of service resumption on Tuesday, June the 16th. This includes an increase in surgical volumes, targeting a return to 65 to 70% of pre-COVID levels in this phase of service resumptions, It also includes a target to return to 90% of pre-COVID volumes of medical imaging. Of course, our goal is to return to full capacity as soon as safely possible, but it's not yet business as usual. Our health services require new safety measures to ensure protections are in place against COVID-19. As we move forward with resumption of services, we recognize that current available beds in our healthcare system will be reduced. We also recognize that many experts in public health are concerned about a second wave of COVID-19 in the next few months. We certainly hope that won't happen, but it's important that we are prepared if it does. As you are all aware, work has been ongoing to establish field hospitals for Regina and Saskatoon. It's now nearing the point where, if needed, work could be triggered to quickly make these field hospitals operational. While we hope we never have to use them, these facilities will in effect be our insurance policy, allowing us to effectively treat COVID-19 patients without having to once again scale back on surgeries and other important health services. So we can move forward with confidence on resumption of those health services. Saskatchewan residents deserve a healthcare system that is responsive to all their needs, while at the same time knowing our health system is well prepared to respond to the threat of COVID-19. Our health system and our dedicated healthcare professionals are working hard to do just that. I'll now ask Scott to make some opening comments.
Thanks, Minister. I'd also like to thank healthcare workers across the province who have been working on the front lines against COVID-19, but also now in that duality of reopening of the healthcare system, ensuring that we open services in a way that's safe and controlled for the residents that we serve. Since May 19th, when the first phase of SHA service resumption was announced, more than 330 services have been resumed across the province. These types of services include examples like harm reduction programs, chronic disease management programs, rehabilitation services, immunization, home care, etc. As the Minister also indicated, this next phase includes targeted expansion of both surgeries as well as medical imaging. And in addition to that, SHA will be opening all of the SHA specialty clinics. These include examples like cardiac catheterization, cardiac stress testing, eye centers, CAS clinics, and numerous other programs across the province. I'd like to reemphasize, as the Minister did, that the services are going to look a bit different than they did pre-COVID. As we gradually and safely increase service levels, we are learning how to do that in different ways. The new ways require us to take special precautions around physical distancing, cohorting our staff, PPE usage, and infection prevention and control. We know that this has made for adjustments for patients, and often it results in longer waits and additional steps during the care process. We continue to express our gratitude to the public for their patience and understanding about the need to take these extra safety measures as we reopen our healthcare system. What the public needs to also know is some of these changes that have occurred during COVID have resulted in improvements that we believe will carry on and help transform the Saskatchewan healthcare system in years to come. One of those examples is the use of virtual care opportunities for patients to access physicians and nurse practitioners since the beginning of COVID. Since that time, over 122,000 appointments have been delivered through virtual care across Saskatchewan. This is an enormous number over a very short period of time. It has helped mitigate some of our situation relative to the slowdown of services, but also services that would have been stopped if it was not for virtual care visits being enabled early in March. These changes are also going to help in the longer term. We believe that we are in a much better position as a Saskatchewan Health Authority and a system to leverage virtual care into the future to help serve residents across this province, bridge geographies, and help support services on an outreach basis. Saskatchewan continues to do a phenomenal job in keeping our curve flat and protecting one another from COVID-19, but we need to continue to be vigilant and abide by our principle to prepare for the worst while we aim for the best. That's why, as the Minister mentioned, the Field Hospital Initiative is so important, but it's also why it's important for us to increase our emphasis on testing. While we know the percentage of people being tested have a very low rate of positivity, this is a good signal that our testing strategy throughout the COVID-19 pandemic has served us well. But we also know, as we've set up more than 50 sites across this province to improve access to testing and significantly increased our testing criteria, we are still not seeing folks attend testing like we expected them to. So in the upcoming days, we will be increasing our public communication around testing to try to reduce anxiety around what the process involves, as well as reduce any stigma attached to getting tested. This is part of our ongoing efforts to identify and reduce barriers to testing, which will be ongoing throughout our response to COVID pandemic over the months to come. This is critical work in light of the progress that we have seen with the Reopen Saskatchewan plan, as well as the plan that we've seen evolve over the reopening of healthcare services across the province. By increasing both economic activity and introducing additional services across the province, we know from the Saskatchewan Health Authority perspective the volumes of patients that we will see in our facilities are going to increase. And with that, there is an increased risk of transmission and an increased need for effective protocols to keep people safe. And although June 16th is the next date for Phase 2 of service resumption, it is also a critical part of the process will include assessing readiness and safety checks before each and every service is restarted. This will ensure that all our COVID-19 related precautions are in place. And as long as COVID is here, we will remain working through this balancing act and duality of the healthcare system of maintaining a pandemic response, reopening our healthcare services safely across the province, and managing outbreaks as they evolve. With that, I'd like to open up the floor for questions.
Thank you both. We'll now move to questions. Operator, can we have the first question?
We have Phil Tank with the Star Phoenix.
Yes, I'd like to know what your what the backlog is like of procedures. And if you don't have exact numbers, I'm wondering if you could give me an idea of what percentage of the backlog you feel you're at right now.
You know, Phil, I don't have the exact numbers across each and every service. For sure on surgery, I believe we have some numbers, but I would ask Susan and or Rashad if they have those handy, and if they don't, we can certainly provide those afterwards for you. Susan or Rashad?
It's Susan Shaw. I don't have them immediately available, but I know that we are tracking them, and the resumption is helping us work through those lists with a focus on making sure that the patients with the greatest need have the first access to everyday healthcare services, but also to surgical and diagnostic care. And Dr. Hansia might have something to add to that.
Unfortunately, I don't have, it's Rashad Hansia. I don't have the numbers handy either. But I think the important points, and I think they've been alluded to already, are that we understand that there are people out there with needs, and we're working through in as fast a way as possible to be able to meet those needs as we maintain the ability to fight against COVID as well.
Do you have a follow-up question, Phil?
Yes, there's two more phases to the SHA resumption plan. Any idea when we should expect to see those?
So like we've seen with the province's reopening plan, Phil, the health system is on the sort of that same time frame. We're looking at 2 to 3 week periods between phases to ensure that as we open up services and learn more about what our actual capacity is to provide care across the province, but also how the COVID virus is going to respond to these changes, where we see an increased mingling of people coming into our facilities for appropriate care, but also it will test our safety precautions that we've put in place. But our plans are, like the Reopening Saskatchewan plan, is to try to be on a 2 to 3 week cadence at minimum to see where the virus lands as we reopen these services. I don't know, Rashad, did you have anything to add to that?
No, I think that's absolutely right, Scott, is that we, in terms of the following phase, which will be phase 3, there is that, we're hoping within 2 to 4 weeks to be able to move on. But again, there's so many variables that depends on. We will be monitoring things internally and externally as well in terms of the numbers of COVID cases, our ability to safely get people through, and taking into account the new infection prevention control requirements, as well as the public health orders, things like physical distancing of people through facilities. So these are all things that, as Scott mentioned earlier on, we are monitoring and learning from continuously, and that will, of course, inform our ability to move through, all the while understanding that we're going to try to maximize the amount of service that we're able to deliver to people in as short a possible time, doing it safely, of course.
We'll take our next question. Operator?
We have Callie Stefano from CTV.
Hi, how much are field hospitals costing to construct and supply this equipment? And what are the predetermined triggers that would lead to field hospitals being open to patients?
On the triggers and the more specific costs, I'll get Scott to jump in a minute. I would just say that overall, there'll be some fixed costs. The labor costs, for example, those will be set, and those will be a cost for setting up. But much of the costs involved in setting up the field hospitals, equipment, supplies, those sorts of things. Again, I'll reiterate, we hope we'll never have to use the field hospitals. That's like an insurance policy in case, as many experts are warning, there could be a second wave. But the supplies and equipment, those can be, there'll be an inventory and they'll be transferred and used in other facilities. Scott, if you have more of a breakdown.
So with respect to the creation of the field hospitals in both Saskatoon and Regina, we don't have all the final cost in because we're not done the completed, but either the construction or the setup. But from a ballpark perspective, right now we estimate that it's going to be in the range of around $8 million for both facilities together, which would include all construction costs. It would include all equipment, all the IT services, and as the minister has already stated, much of that would be reusable. So the philosophy we used when creating the context around field hospitals is the equipment that would be used in a field hospital is the same type of equipment that would be used in a normal hospital. So as the minister has already outlined, is we would be able to redeploy if the equipment wasn't used, or if it was used, we would have the ability to reuse it at any given time to set up a field hospital for any other reason whatsoever. The one thing to remember is just like the SHA as an organization, our single biggest expenditure is the cost of our staff. It's about 80% of our total spend when you include medical remuneration. So that would be the same for anything. So although we're not spending any money today on staff inside those field hospitals because they're not open yet, that would be by far the single biggest expenditure if we had to open it up. Now, with respect to the second component of that question, Kelly, around the triggers, I'll give you a high level, and then if Susan and or Rashad wanted to add to that, then they certainly could. So the hospitals being set up in a way so that we can use them to have capacity for acute care near our two biggest centers. We would obviously have to see a combination of significant bed utilization for non-COVID work across the SHA, not just in Saskatoon and Regina, because we would look provincially at access to acute care beds, and then at the same time a major surge. So those two things combined would be what we would consider a trigger, and the team has worked out a trigger for reopening. So I'll pass it off to Rashad. But the only other thing I would mention before I do pass it off to Rashad is one of the other things that would determine the use of the field hospitals is, for example, if we had a major outbreak in one of the larger facilities in Saskatoon, Regina, and it was a small number, let's say, of COVID cases, but a large number of staff that were impacted by those cases, that could also result in a reduction of beds that we may use the field hospital to help support that work as well. But I'll turn it over to Rashad or Susan if they have anything to add.
I don't think I have anything to add, Scott.
Okay. Thank you.
Kelly, do you have a follow-up question?
I do, yes, thank you. For residents who will be able to go in for their surgery in phase 2 of the SHA plan, will loved ones be able to join them as well?
With the new criteria, there are some aspects of what type of surgery you're receiving, but I think Susan probably would be the best one to answer that question.
Yeah, so the public health measure and the state of emergency are still in place, which is what is having us with the visitor or family presence restrictions across the health authority. And with the expanded definition of what compassionate reasons means, it does mean that a person having surgical care that's a major surgery, such as heart surgery, a cancer-related surgery, or anything that requires an admission to intensive care, they are able to have one person attend with them, but unfortunately we're not able to expand beyond that at this time.
We'll take our next question. Operator?
We have Adam Hunter with CBC.
Good afternoon. I'm wondering if you guys can tell me, are any of today's cases and how many recent cases are linked to international travel?
Dr. Shahab here, I can speak to that. Hello?
Yeah, go ahead, Doctor.
Go
Yeah.
ahead, Dr. Shahab.
Okay, thank you. So, thank you for that. So, the last week, we have had 3 cases, 2 of which are linked to international travel and 1 linked to interprovincial travel. And this is just a reminder that while our total travel numbers are low, we continue to have, obviously, small numbers of international travel, expats returning, or other essential workers returning. And similarly, we continue to have essential interprovincial travel, and we will continue to see both cases popping up in the community at very low numbers, which we are seeing now, and also occasionally travel-related, either international or interprovincial. But overall, our case numbers total remain low, and cases due to importation or interprovincial travel remain low as well. Thank you.
You have a follow-up question, Adam?
Yes, I'm wondering, should people who attended the recent rallies in Regina and Saskatoon, I know there's other ones happening around the province, should they be tested for COVID-19? Will they be offered a test if they call 811? I know it was just mentioned that you're trying to increase the number of people tested.
So, Dr. Shahab here, I can again speak to that. So we encourage anyone who has any concerns, especially if they're out and about and feel they were not maintaining physical distance, to consider testing if they feel uncertain. Obviously, testing is especially recommended if you have any symptoms of COVID, but we do know that occasionally you can be asymptomatic and transmit to others, especially your close, household members who may be more vulnerable than you are because of age or other factors. So based on that, if people were at rallies or other events where they feel that they could not maintain physical distancing and want to get tested, testing is available. Thank you.
We'll take our next question on the line.
We have Lisa Schick with CJME.
Hi. We have just 21 active cases right now. So what do you say to people who look at that and they're waiting for procedures or testing, sometimes in real pain, and they feel that this isn't going fast enough?
Yeah, go ahead.
Well, Lisa, what we say is we're working as hard as we can as quickly as we can and as safely as we can to restart and resume services across the province. We know that through our response to COVID and that response that existed across this country, that there were many folks, not just folks requiring surgery, but people looking for diagnostic imaging tests or just care for their chronic conditions that have had reduced services throughout this last few weeks and months. And that's why the resumption services will work as aggressively as possible to prioritize those folks that have had their procedures postponed already, but also be built on based on the need of the patient and the ability of the system to actually respond. It's important for folks to understand that we will be working as quickly as possible to address their healthcare needs, but under a COVID world, we don't work. We just simply can't work at the same pace with volumes, but we will as quickly as we can get up to those volumes as we plan to do with respect to phase 2 and phase 3. I don't know, Susan or Rashad, did you have anything to add?
It's Susan Shaw here. I think that we are still in a pandemic, and as Dr. Shahab just reminded us, the presence of the virus is still known, and it's going to pop up here and there. Our job is to be monitoring, to surveil, and know and identify as fast as possible. But we also know that that takes. There's a lot of new processes within the province and within the health authority to ensure that we're as safe as possible. and that there's that balance between resuming as fast as we want to and as fast as we can in terms of making sure all the safety precautions are in place. We also know that we need to make sure that our staff remain safe and that the ability to maintain all of the precautions remain in place.
Do you have a follow-up question, Lisa?
Yes, Minister Reiter, you mentioned a possible second wave, and there has been a lot of talk about that possibly coming in the flu season this fall, a few months away. Would it make sense to get as many surgeries and procedures done as possible before the flu season and a possible second wave might hit?
Certainly, even before the pandemic, Lisa, we had announced a surgical initiative last fall to take place this spring, which had to be put on hold to try to get surgical numbers much lower. So we recognize the need for surgery. Certainly, that's why we're moving as quickly as we can while still being safe with this. But you mentioned much talk about that. There's public health experts across the country and around the world warning about a second wave. So I come back to the field hospital capacity. That's why we want to have that capacity, so that in the eventuality, while we hope that second wave doesn't happen, we want to be prepared in case it is, in case it does. And if it does happen, that way it'll have a minimal effect on the services that we provide, as opposed to when we had to shut many of them down this spring.
That concludes today's availability. Thank you all for taking the time to join us.
Thank you.